A Brazilian butt lift reshapes the body using your own fat. 2 procedures combined into one operation. BBL stands for gluteal fat grafting. Fat is removed from one area of your body and shaped into the buttocks. Common reasons include flat shape, asymmetry, hip dips, or wanting a more defined waist-to-hip contour. Good candidates are adults with stable weight, enough donor fat, good health, and no active nicotine use. Surgery has 3 stages: liposuction of donor areas, processing the fat, and injecting it into the buttocks. Liposuction targets the abdomen, flanks, lower back, or thighs through tiny incisions just a few millimeters wide. The processed fat is layered into the buttocks using blunt cannulas, placed only in the layer just under the skin. Plastic surgery societies advise injecting only into this surface layer to avoid a rare but serious complication. For 2 to 3 weeks, direct sitting is avoided. A special cushion supports the thighs and protects the new shape. Swelling fades over weeks. By 3 to 6 months, the surviving fat settles and final shape becomes clear. Some grafted fat is naturally reabsorbed. Surgeons account for this, and stable weight helps preserve the result. Risks include bleeding, infection, fat resorption, asymmetry, and the rare but serious risk of fat embolism. Choosing a qualified plastic surgeon in an accredited facility and asking about safe technique matters most. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.